What is drug abuse?
Jeff Wable.
What is your profession?
I work with Utah County Sheriff's Office. Been a deputy sheriff for 13 years.
All right.
Drug abuse is using a substance, a controlled substance that is essentially harmful to your body, your life.
Nathan Christian. I'm a pharmacist. Drug abuse is when somebody takes too much of a medication to either get a high or just to feel better, I guess you would say.
Okay.
My name is Michael Sheets.
All right.
I am the laboratory director here at the Water Resources Laboratory for the City of Provo.
Okay.
Drug abuse,
Yes.
it is the improper use of medications.
What's your name?
Dr. Greg Nielsen,
What is your profession?
physician,
Mm-hmm.
specialized in family medicine. I work both at a methadone clinic, Project Reality, as well as over at BYU. Drug abuse would be the use of any medication for any purposes other than its intended use.
Okay.
Kai Norfeld. I work as the coordinator of the substance abuse, the SMART Coalition, Substance Misuse and Abuse Reduction Team. Now we're talking about prescription drug abuse, right? So drug abuse, let's say if you were to go and get a pain pill from your doctor and you're using it for pain in your back, if you're using it for your pain in your back, then you're using it for what the doctor intends you to use it for. Drug abuse is if you were to use it to get high, to alter consciousness, to try to deal with the stress you have in life. So if life was getting hard at your job or hard in a relationship with someone that you really care about, instead of dealing with those head on, you use a pill to try and make you feel better, even though it doesn't solve anything. So that's drug abuse.
Who is most likely to abuse drugs?
I think as far as that question is, I think everybody's susceptible. I think you're just as susceptible as the next guy.
I honestly don't think that you can pinpoint a specific population. You would think maybe like the stoners or the crackheads, you would say, but we see a lot of people that are abusing medications that looking at them, you would never ever know.
But I think that's a loaded question, because a lot of times we think of someone who lives on the street as being a high risk, which maybe they are, but in my experience, drug abuse hits all walks of life. So whether it's a physician like myself, maybe an anesthesiologist who has easy access to lots of drugs, or any physician for that matter can abuse drugs, all the way down to someone who is homeless and living on the street.
Typically it's male. The studies show, females don't abuse them at as high of a rate. Typically the age group is towards the end of high school and into the college years are the typical age groups where you see it. It typically trends off around the mid-20s for most people.
Right.
There are a group, once they develop addiction, where it goes, it could be a lifelong challenge for some people.
Right.
Do you think that prescription drugs are more dangerous than illegal drugs?
I think there's the potential for being just as dangerous, and I think especially today there's a big problem with prescription drug abuse. A lot of people think it's okay because my doctor prescribed it for me,
Right.
and he wrote it for me. But when they start abusing it and misusing the medication, they're not taking it as directed. It can be very harmful to them, and there's the potential for even more damaging effects of prescription medications because of side effects than things like heroin and marijuana and such. So.
I don't know if they're necessarily more dangerous, but because there is an aura of legitimacy with using them, I think the potential for abuse maybe is higher. For example, you go to the doctor, you have an appendicitis, you come home with some pain pills, and you might start taking that and feel, or you have back pain maybe from an injury. And I think it's very easy to slip into an addiction issue because initially it was prescribed by a physician and then you begin to abuse it. So maybe a little more seductive than something that's blatantly that you know is illegal and maybe has a risk.
More people die from prescription drug overdoses than die from all automobile accidents combined. That's a pretty alarming statistic if you think about it. Do I think it's more harmful than the others? It just depends on how people use it. If there's plenty of people that overdose and die on, heroin as well. It's a tricky thing. The best thing to do is just to stay away from them altogether.
Do you think marijuana should be legal?
Boy, that's a loaded question. That's something that's hotly debated through the country right now. My understanding is there's very limited use for medical marijuana. That would include intractable seizures as maybe the only use. I've heard chronic pain, although I'm skeptical about that, or glaucoma. So I think it has a very limited role, but possibly a role for legitimate medical use. I certainly am not in favor of legalization that's taking place.
Should we increase education on drug abuse in our schools?
I'm a big believer in education. I think education is always important. I think working in the methadone clinic, I see the results of what typically heroin or the use of hydrocodone or oxycodone abuse leads to, and it destroys individuals, it destroys families, and it becomes something that people have no control over.
Okay.
And I think if people were aware of that, they'd maybe be a little more cautious when they use their prescription medications, and maybe even be inclined not to get involved with things like heroin, which can be injected or snorted or whatnot.
How can we prevent substance abuse?
That's a good question. There's a lot of states that pharmacists are pretty involved in, and Utah is one of them, where there's a prescription drug monitoring program where I have access to a database that I can go and look up patients that may be abusing medications and see if they're trying to fill it too early. In Utah, there are laws restricting how frequently you can fill controlled substances. So I think that's a good start. Making more people aware of the problem would be another thing.
Right.
And especially working in conjunction with prescribers and pharmacists and the whole healthcare team working together to help people, if they are addicted, help them get off their addictions. And if they're not addicted, make sure that they don't go down that path.
The studies show that the best way to stop drug abuse is actually the most effective strategies are to make them very expensive and hard to get. So when it comes to alcohol, right now, alcohol is incredibly cheap. So if we really were serious about getting kids to stop drinking alcohol, what we do basically is tax it at a much higher rate.
Right.
And people don't have enough disposable income. And you think about cigarettes, for example. We've seen dramatic decreases in the overall use of cigarettes, and they often correlate with the increase in price. We tax cigarettes at a very high level, and we've seen a decrease of cigarette use over time because people eventually say enough's enough. Really laws, we need to look at our laws and figure out what laws are encouraging people to use drugs or discouraging people to use drugs. So for example, coming up on this marijuana legalization, we need to do everything that we can to avoid legalizing marijuana, because that's going to make it more available, it's going to bring the price down, and it's going to provide a lot of other products in the community that kids will have access to. So very important that we do everything we can to promote good drug policy that works. That's the most effective thing you can do. Education is actually further down the list. If we can have parents educating their kids in the home, that's the best solution there. If parents basically apply 3 strategies. They love their kids, bond with them, have fun with them, have mealtime, dinners with them, do the activities they enjoy. If they set clear boundaries for them, say, look, we don't do drug abuse, we don't drink alcohol in our home, we don't smoke marijuana, and here's the reasons why. Teach them about how it harms the brain, harms the body. And then if they monitor the kids' behavior, if they, on a Friday night, if they come and check in on their kids and find out what they're doing, make sure they're not, in a party that has drugs, that's also, effective at the family level. That's really where a lot of good work happens too.
How does substance abuse affect our water?
Shem Lichty. I'm a civil engineer, a registered engineer in the state of Utah. I'm also a vice president of the company, and I lead a group of engineers nationally for the company in water distribution, modeling, and planning. One of the important ways to help prevent prescription drug abuse is to properly dispose of your unused and unneeded or leftover prescription drugs. But the important thing there is to dispose of those drugs responsibly and appropriately. In the past, even hospitals would take the leftover prescription drugs and simply flush them down the toilet. We know today that that's a bad practice and one that causes a great deal of problem. That's because water gets used over and over again, especially in areas where we're using surface water as a source of supply. Those leftover prescription drugs that get flushed down the toilet end up in someone else's drinking water and can cause a great deal of problems.
Okay, so here I work at the water reclamation facility. We receive wastewater that comes in through the system. Anything that goes down the drain, anything that goes down the sewers, comes here to the wastewater treatment plant. A lot of that's going to be organics, food waste, paper products, things that can break down and decompose. But there are some things that can't break down and decompose, and a lot of those things are drugs, medications. We have a number of physical properties, processes, chemical processes, biological processes that break down what comes down the stream and enters our treatment plant. Some of the microorganisms can remove a lot of that stuff, break it down, metabolize it, consume it, but some things pass through. Very similar to you taking a large dose of vitamin C. You have a cold and you start dosing on vitamin C. Your body's only going to use a small percentage of that, and the rest is going to flush through your system. It comes here to the wastewater treatment plant, and some of that's removed here as well, but not all of it. So there's a number of things that go through our processes and end up back out into the environment.
Okay.
That could be unmetabolized drugs that'll pass through the human system. It could also be steroids, medications, hormones, whatever our bodies don't use passes through, we flush it down, it comes here, and in some cases doesn't get removed by the treatment process. Yeah, I've seen an interesting scientific study that showed, the frogs that are starting to be born with multiple legs, or deformities, or sex changes, especially in aquatic animals, not only amphibians but also fish species, where there's some sex changes that are being traced back to these endocrine disruptors. A lot of that being female estrogen, and re-enters our environment, gets into a water stream, water environment, water habitat, and affects the aquatic life that live downstream. And maybe even the best avenue is how we can prevent it from entering the stream. So it behooves us as human beings to be more concerned and aware of what those drugs are, what we're safely able to get rid of, and what is not safe to get